Success. All right. So technology, 1, 2, 3 screens and a microphone. It's working. Okay. So here we are. I have BioT branded slides because I don't believe in reinventing the wheel, but I did add some stuff. So it's not just their canned presentation, but I really enjoy the information that they share because it's all science-based. It's founded in functional medicine, and it helps me have a great foundation to just do some talking with you. So today we're going to define hormones and hormone imbalance. We are going to discuss perimenopause, menopause, and all the others. I threw andropause in here because there was a couple of guys that were making comments about wanting to show up. They're not here. I think they were scared. We're going to discuss body composition and the impacts that it has on our bodies as we go through menopause and as we age, and how important that is. And then we're going to explore the modalities of hormone optimization, things and tools that we have here that we can assist you with if you need a little extra support, or if you want to biohack your way into like quantum leap into, the next phase. So the good stuff. Now we're going to see if I can advance this. Okay. All right. So with the hormone imbalances, what do you need to know? Who should you believe? And what can you do? All right. So there's a lot of information out there. There's so much information out there. It wasn't that long ago that everybody was on hormones because it was the greatest thing on earth. 1940s, 1950s, 1960s, 70s, women were on conjugated equine estrogen, Premarin. So pregnant mare urine estrogens. They were on progestins as well after they found out that just using conjugated estrogen in women that had a uterus caused uterine cancer, endometrial cancers. So then they added the progestins to help that. The problem is progestins are not bioidentical progesterones. We need those in the body. And so there's been a lot of studies, and it's kind of a controversial thing. So I'm not going to go into all of the grand detail of it. Suffice it to say, there's been data that showed all hormone replacement might cause breast cancer, uterine cancer, ovarian cancer. Then there's research on the other hand that when they redistribute the data, it depends on what type of hormone replacement it is. It depends on if it was balanced estrogens and progestin or progesterones. It also matters if it's testosterone included, because testosterone is really protective actually for the female cancers. We're going to go into a little more history about that as well. Any of these that you want white papers on about the studies, I have access and I can email them to you. So anything that you want more information on, I'm happy to share my sources. They've kind of done a roundabout on that. Nobody should take hormones because it's going to give you cancer, give you heart disease. When they strategized or aligned the research. And they found that the bioidentical hormone replacement actually had improvement in those areas. So improvement in heart disease risk, improvement in Alzheimer's risk, improvement in body composition, bone density, and there was some evidence of potential protection. With any kind of female cancers, I always want to be working directly with the patient, with their oncologist, to make sure that they want and need replacement and that we're using the safest options available. Some women don't qualify or just don't want to take the extra risk, and that's okay. We have other ways to help with that. But we have some folks, we use testosterone with anastrozole to block estrogen, and so we still get the good benefit of the testosterone androgen replacement without increasing the risk of estrogen replacement or estrogen production in the body. So a lot of data. You do need to kind of do some research for yourself. Not knowing statistics or not knowing how to interpret research studies can be really complicated. And that's why people don't know what to do. They are listening to every resource and professional and expert out there. What I will say is that I very much appreciate the education that we've gotten from BioT, from IFM, from the Dr. Andrew Weil Center. We've had a lot of different opportunities to study at least the safety and efficacy of hormone replacement. And in the last several years that I've been doing BioT hormone replacement here, watching my patients and how they proceed through and thrive. Again, not everybody's on hormones. We have other things that we can do to help. That's what I love about integrative and functional medicine, that there's natural ways that we can help people do better. So what are they? What are hormones and why do they matter? Why do I care? They are little chemical messengers. So say you see somebody that you love a whole lot. All of a sudden you get like the little, butterflies and the heart pitter patters, and then maybe your stomach hurts. You know, it's this whole thing. The thing that makes the stomach hurt is actually a neurotransmitter. That's kind of like a hormone. All right. Estrogen, testosterone, progesterone, they are specific sex hormones. They're steroid hormones. They don't just work in the gonads or the ovaries, testes, uterus, or breast. They actually have receptor sites on different parts in the body. So it does matter. It matters to your brain, it matters to your heart, it matters to your bones and your muscles and all of your other organs. So a deficit, there's a reason that when women hit menopause, it's like they had a 5-year time warp in aging if they don't find ways to either naturally or through some support help their body with the hormone deficit or the hormone changes. So it's something that I see often. They kind of work in a lock and key fashion. The thing that's really important to know is when we're using bioidentical, they fit the lock. When we're using the similars, the biosimilars like Premarin and Progestin, they kind of bind in there, but the little toggles on the end of the key don't really match. So the other things that are supposed to stick and work don't work right. So this is the $1 million question. Do we age because we lose our hormones, or do we lose hormones because we age? Does anybody know? I don't know. It just happens, right? And we all have our own age at which our hormones start to change. So I don't have any data per se to back this up in a study, but what I see in my practice is the later you start menstruating, I see earlier perimenopause and menopause start. The earlier you start menstruating, it seems like we have a longer. It would seem like it might be different, but I just have a feeling that has to do with our genetic predisposition, the egg production, our follicle development, and all of that. So that's what I see in my practice, is that those folks that start late tend to start having symptoms in their 30s and early 40s rather than waiting to that median age of 51 for menopause. Again, that's what I see. I don't have any like study to back that up, but that's what I'm seeing in my practice. The other thing that's going on here. So the world that our mothers grew up in and our grandmothers grew up in is a different world than we're living in today. The rampant use of chemicals in every product that we have is completely obliterating our body's ability to properly manage our hormones. We have plasticizers, volatile organic compounds, glyphosate, BPA, all of these things are in our bottles, our cups, our packaging, our skincare products, our clothing, our furniture, our carpet, and they go in and they interrupt the body's ability to transform hormones the way they should, or it impairs the body's ability to excrete hormones. And that is also dangerous. That's more concerning to me than having healthy bioidentical hormones in the body. We want to be able to detox them. They have to get out, or they turn into ugly clones that don't do what you want them to do. I don't know if anybody remembers the Michael Keaton movie Multiplicity, where he cloned himself over and over and over and over. If you haven't, it's kind of funny. You might look for it and watch it, but basically the more times he duplicated himself, the more awkward and dumb and not quite right his clones became. And that's what can happen when you recycle estrogens in the body. So question is, how do you feel? Do you feel like this? Or this? Or this? Or like this? Like, life is great. I'm having a good time. Let's go take a selfie. Let's go to dinner. Let's enjoy things. So what I hear often from the women that come into my practice is that I can't sleep. I'm tired all day. I have no sex drive or libido. I hate everybody, or everybody hates me, or I get really irritated really easy. You know, my trigger is really short, or 1 minute everything will be fine and the next minute I'm crying or feel like the world is ending. On top of that, I'm gaining weight. Why am I getting fat around the middle? I've always been fit. I'm still working out the same. I'm still eating the same, but now I'm getting heavy. What's happening? I don't know what's going on in my body. I went to my doctor and they just told me everything's fine. They did some lab and said it all looks normal, but I don't feel normal. Can you help me? Joint pain, brain fog. I started thinking everybody in the world had brain fog, and then I realized I'm seeing a whole bunch of perimenopausal women. We all do have brain fog. We all have it. And the worst part is when you're all together, like, what were we talking about? So it's a real thing and it's a real problem. And so the hot flashes, night sweats, that's what everybody hears about when I'm going through menopause. Those are kind of, yeah, people have them. But these other issues are really significant and can be precursors or kind of that promontory notice that things are coming. And so what I think is really important is that you find a provider or a place to go that listens to you and doesn't just poo-poo it off as like, oh, your labs are fine, or um, this is part of aging, get used to it. You know, here's an Ambien, it'll help you sleep while you like drive the dog to the car wash in your sleep. I don't love those medications. Or here's an antidepressant for those tears that you have. And what we're doing is we're painting the roses red. That's what I call it. That's conventional medicine. We're not managing the root source. We're not fertilizing right. We're not transplanting those roots into healthier soil. We're not creating a situation where the plant has room to bloom. We're just kind of covering it up. And so that doesn't really work for long. Those roses will still die and fall off. And so I love the opportunity to help people feel better. So this is, again, I'm using the BioT slides. So I left some of theirs in just because, they're still there. What I like about the BioT method, this is why I work with them on my hormone pellets and hormone replacement. It's not just pellets. We can do topical creams. We can do injections. I don't love the injectables for women, but for men, the testosterone injections work pretty well. If they don't want to do pellets. But 503B pharmacy, meaning they compound it. It is sterile. It is using bioidentical processes when we create the creams or the pellets. We use serum labs, so we get the idea of what's going on and what hormones are circulating in the body. I have the capacity of the practice to do urine and saliva. Urine is helpful to let me know what the end organs are getting. When I say end organs, what the tissues have converted. So when we test urine, we've essentially are measuring urine and the kidney excretion of the hormones. So it's what the body's ready to get rid of. So it kind of tells me what's been used up. And the blood tells me what's available floating around in the body for the body to use. And we don't just check sex hormones. What's really important to me is to know the vitamin cofactors that help the body convert hormones, the thyroid hormones. I want to know your ferritin to see if you have inflammation or if we need to look at iron deficiency. We look at your blood count and sex hormone binding globulins. So if you have hormones, but they're all bound to these vehicles that carry it around and we can't offload it because we don't have the right vitamin cofactors, it's great. You may have a whole bunch, but if you can't use it, you're still going to feel like you have a deficit. I add in a few extra tests in what they do because I truly believe that we need to know what progesterone is in women, even though we're going to supplement it. I want to know what our estrogen progesterone ratios are so we aren't having breast tenderness, raging hormones, putting you back into feeling like you have PMS. So that's important to me. So we balance that well. We have a it's a dosing algorithm that uses 300 different data points that helps us idealize your preferred dose for hormone replacement if we want, but it also tells us what kind of supplementation might benefit you most. We use testosterone and estradiol pellets. If you need estrogen, you don't always need it. And a lot of women are like, why would you just do testosterone? I'm not a dude. Well, in menopause, testosterone is the predominant hormone because estrogen and progesterone reduce because ovarian function diminishes greatly. Testosterone is made in the adrenal glands, and then the fat cells convert the testosterone into estrogens. And that's great. So what I see though is some women who've been menopausal for 10 years, but they're overweight and their body is still converting all of their testosterone to estrogen. So they still have the idea of estrogen dominance. So it's really important to me to, can you put yourself on mute, please?
Yes.
Thank you. But yeah, so not everybody needs estrogen because our body can convert it based on the testosterone we give. And we do not use the values on conventional labs that say your testosterone is normal. We push you to optimal. And optimal for some women is like 100. Some people it's 150. Some people it's closer to 200 on their testosterone. You're like, wait a minute. Okay. If a normal woman's testosterone on lab says 12 to 28 or 12 to 45, depending on which lab you're using, why do you want it to be that high? Well, because I want to feel good. I don't want to have just enough to not be feeling like I'm on death's door. I want to feel better. And those ranges that they give are based on values that are on women 18 to 90 of all varying health status, averaged, dissected into tertiles, and then we get, our outlying ranges. What we really want to do is look at women who are in optimal fitness, optimal body composition, and optimal health. And that's where we get these higher ranges. That's actually, people who are moving and working out more can push their testosterone with benefit to the higher range. So that's why we do that. And again, like I said, thyroid we look at, and nutraceuticals. So vitamin C, vitamin D. We don't just use plain vitamin D. We use vitamin A, D, and K because those cofactors work together to optimize that hormone function. We look at brain health, heart health, and support those along the way. So testosterone deficiency, I won't beleaguer this because we don't have any men here. I can host a men's meeting in the future, but this was a menopause meeting for women. So yeah, men get andropause. Man boobs, weepy, moody, no motivation, low sex drive, and they start getting the keg instead of the beer belly. It starts getting really big. And the bigger that gets, the more estrogen they make, because where does testosterone turn to estrogen? In the fat. And so it's this vicious cycle, and they cannot recover their testosterone until we help them out and we get them losing weight and getting that body composition improved. So without testosterone, men have a high risk for early heart disease, diabetes, hypertension, sleep apnea. There's so many things. Alzheimer's disease. It's really important that everybody, you don't need hormone replacement, but if we can get you healthy first, you have a prolonged time in your life where you can have optimization naturally. But so many of us these days and our loved ones aren't there because of the environment we're living in. So here's some facts. It's made in the ovaries and testes. Males between the ages of 30 and 70 may lose 1 to 3% a year. But look at women. They may lose half of their production by the age of 40. It just falls off quickly. Sex hormone binding globulin increases with age, lowering free active testosterone. And so that's really something when you, like I said, the little vehicles that carry it around, if we have too much of it, it doesn't offload the hormones to the target tissues. So benefits of testosterone for females will have an enhanced libido, improved bone mineral density, which is really awesome because this one has the caveat when it's in combination with estradiol. So this is our women who are postmenopausal who need estradiol. Our premenopausal women can still be on testosterone. I've pelleted people in their mid 30s because in this day and age, people are deficient. They just don't have enough hormones, and we want them to have energy and be able to sleep and function. Vaginal dryness is a really big complaint, and it starts really early. I have women in their late 20s, mid 20s that are still struggling with this. So depending on what they need in that age group, I don't want to put pellets and hormones in them. I want to help their body optimize the production of hormones naturally to the best of my ability. So we use lifestyle, we use sleep, we use mindfulness, we use food, and we use supplements to help them succeed there. For males, we see reduced body fat, stronger bones and muscles, improved erections and orgasm, overall feeling of well-being, enhanced sleep, and decreased fatigue. Increased lean body weight. So I don't really love the way they did this females, males, because females also get all of those things. You can slide this under the females. Yes.
So I started the bio.
Yeah. Yeah. So
everything.
This is the story I hear over and over. So thank you for sharing that, Jonna. But yeah, this is the part that I love about the job. I mean, helping people honestly get their life back, because it's not fun to be sad and angry and scared and unhappy and asexual. It's not fun. It's not fun at all. So these are some that I added. These are my slides. Perimenopause. You got to understand some of the lesser known symptoms and understand it's also not all in your head. And these symptoms can start 10 to 15 years before menopause is even knocking on your door. So when you're in your late 20s and early 30s, depending on when your mom went through menopause, that's one of the best markers, is to know when you're going. Fortunately or unfortunately, a lot of mothers for women our age had a hysterectomy early because that's the doctor's cure for everything. Take it out, rip it out. We don't know when she went through menopause. So yes, it's not all in your head. So we're going to go through some of these lesser known symptoms. We're going to talk about natural hormonal and lifestyle interventions. And this is a whole person approach to wellness. So brain fog and cognitive changes. These are what did I come into this room for? Where are my glasses as they sit on your head? Where did I put my keys again? I know they're in this room somewhere because I got home. They aren't lost. Where are they? This feeling of mentally sluggishness or having a fuzzy brain of just like, I can't get myself together in the morning. I need more caffeine. I need more caffeine. Give me coffee, 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 coffee. That actually is harder on your system. So I actually try to teach against over caffeination because that messes with your adrenals, which again is part of this hormonal axis that I'm trying to heal. Ways that we can help this is omega-3 fatty acids and antioxidants like vitamin C and E, which is part of a good supplement program. You can get a lot of these through diet, but getting quality food can be expensive for some folks, and it can be a challenge, especially in Manhattan, Kansas, where for whatever reason we can't get organic, healthy food all the time. Lifestyle, blood flow. Think blood flow. We want to breathe and put oxygen on the blood cells and circulate those blood cells into the brain. So exercise, meditation, yoga, and good sleep. If we don't sleep, our brain dies. There's no joke. One of the studies they showed us in my medical school was a rat study. And they tried to do it with a human study, but people were getting sick within a few days of not sleeping. They made people not sleep. So with rats, they're like, oh, let's use rats. So what they did is they had rats that got 2 to 4 hours of sleep a night. So they were sleep deprived. They weren't optimal, but then they had rats that didn't sleep at all. And rats started dying at 7 days because their brain couldn't function anymore. And so we aren't rats, but our brains are very sensitive to sleep. So my women who can't sleep, I do want to help them get sleep. We use magnesium. Hormone replacement is phenomenal for sleep. I mean, organizing that. The other thing that's kind of magic when you do hormone replacement is that you start to dream again. If you didn't dream for a while, it's really nice to like have those pleasant dreams and remember them. So the next thing we want to talk about is the emotions and mood symptoms. So it's not just feeling a little anxious or a little off. It's not that crying at the Sarah McLachlan dog commercial where, you know, arms to the angel and everybody's like, oh, she's so sad. No, this is the one where somebody can drop a Kleenex. You're like, oh my God, do you hate me? Like, what did you do to me? Can you just pick up after yourself? Or the rage because somebody didn't shut the cabinet door the right sound, like the volume was off. So these are the irritability, the anxieties, the rapid changes that can occur that are out of proportion to what they should be. Again, meditation, breathing exercises, getting counseling can be helpful. The omega-3s are great for brain and mental health. And then complex carbs. This is looking at things that are whole carbs, not the cheap, gross carbs. You know, moving away from rice, pasta, bread, cookies, those kind of carbs, moving into complex carbs like root vegetables, sweet potatoes, greens, all of those that you can get some good, healthy, hard to digest carbs. So your body has to do a little work to do it. Whole grains, if your body tolerates them, can be used here, but I'm talking whole grains. We need you to chew the bread. We need you to have to grind up the wheat berries with your teeth. That's whole grain, not processed, soft, mushy bread. Digestive complaints, bloating, irregular bowel movements, IBS-like discomfort. So there's a lot of things released around your cycle, like they're called prostaglandins, and what they can do is they're what tell the uterus to shed the lining when it's time for your cycle. But sometimes we get too many and we end up having diarrhea, or that's how you know your period's coming, because all of a sudden now I'm having loose stools and I don't understand this. And then right after your cycle, you're constipated. You're like, what the heck? Why won't my gut settle down? So that is hormone related. We have to be really cautious with that. The other side of that is your microbiome in your gut can impact those things as well. And so part of what your microbiome is responsible for is helping you excrete, because it's what binds and eliminates the waste product estrogen. So if it's recycling in your gut because you can't clear it, that's also really important to know. So interventions are an anti-inflammatory diet, whole food, high fiber diet, probiotics and digestive enzymes, depending on the person. Again, also trying to help make sure that the microbiome is healthy and that your hormones are better balanced. Adrenal imbalance and fatigue. This is one that is really important to me. BioT does not test cortisol, but it does suggest we investigate it if we're not having the improvement through hormone replacement and thyroid support that we need. What I have, the majority of women who come in to see me about their symptoms, it's because they're more extreme. There are those women who never had a cramp during their life. Their periods were like, oh, it's just another day. And then they're usually the ones that breeze through menopause. Like, oh, I can't remember my last period. I think it was last year, but I haven't had a hot flash, maybe once. Those women exist. They do. But when you look at their life, their lifestyle, maybe they have very low stress. Maybe they move their body a lot. Maybe their diet has been beyond reproach, and maybe they just got the luck of the draw with genes. It happens. So that's possibility. The women I see, though, are not the ones who have an easy time, because people wouldn't come see me if things were going smoothly. And adrenal dysfunction is a big one for me. Stress in life. We're in the sandwich generation. You're taking care of your teenage or younger children, because there's a lot of women who have that 41-year-old baby who now they're 10 and they're going through menopause and they're having to deal with a fifth grader. And then they have their parents who are not doing great. They have to support their parents too. So they're kind of stuck being responsible for everything. And then don't forget their husband who's going through andropause and is moody and crying and reticent. And so she's got the weight of the world on her shoulders, right? So our adrenals put out cortisol. So here's that central obesity. My belly's getting bigger. Why am I not losing weight? This is a big part of that. Sleep. You're not sleeping because you're constantly working in your sleep. Your brain doesn't shut off. You're not able to get good, deep sleep. So these are the things that I look into deeper with my functional medicine program and my quantum metabolic reset program for women who are like, I got all the things and I have a lot going on up here and I need to take care of my mind, body, and spirit. I don't just want hormones. Can you help me get all the way better? So I have that program as well. But it's a big deal. So we support that through herbal adaptogens. Ashwagandha and rhodiola are pretty common ones that people have heard of. There's a whole slew of others that can be added depending on what your needs are. Sleep, eat right, exercise, not too much, because if your adrenals are shot, if you exercise more, you're actually hurting your adrenals more. They need to go into a state of rest and relaxation instead of stress, because if we continue to stress with triathlon training, because if I just keep doing this, I'm going to lose weight. How many obese runners have you seen? I've seen more than I thought I ever would, but they can't lose weight, but their body won't let it go because they're pushing their adrenals to the point that they can't let it go. Supplements like B vitamins and magnesium are really important to support healthy adrenal function. Another one that a lot of people just get told it's arthritis, this is just aging, is joint pain and muscle cramps and muscle aches. I can't tell you how many of my hormone replacement patients come in and say, you know what, doc, I never thought I was going to run again, but I started running and my knees don't hurt anymore. Or my guys, especially, they're like, I knew it was time for my pellets because my hips started to hurt or my back started to hurt again. And it's been fine up until now. So hormone receptors are on the cartilage in your joints. They're in your bones. So that is a huge thing to pay attention to and not just accept, oh, it's arthritis, take some Advil and kill your gut microbiome and your kidneys while you're at it. Let's heal it. Let's find a way to function better. So yes, anti-inflammatory foods, omega-3, turmeric, and ginger, move your body gently, keep stretching. Magnesium for muscle relaxation is really great. Turmeric is great for inflammation. There's a whole bunch of other supplements that help your body's cartilage function better and help you age easier. We work through peptides here as well, because that's another thing to help our body stay optimized longer. But the hormones themselves can make a huge difference. Then there's these subtle sexual and vaginal concerns. So it's the ones you probably don't talk about much, or if you do, it's like, do you have a like it hurts when I sit down because I'm so tired, or I can't have sex anymore because oh my gosh, it's just as awful. It hurts too bad. Things just don't work right. And so we want to address those things. we want to acknowledge those things, that it's not just normal to fall out of love with your husband or have no desire. That's not what life is meant to be, even though that's kind of what our precursors or ancestors tell us, is like, oh, it's just normal. I think it's because they don't know any better. And I think it's okay to have that desire to continue. When I have women and men that come in with a complaint with that, my first question is, do you want it to be different? The reason being is, if you don't mind not having those feelings, the last thing I want to do is bring them on. But most of the time the answer is, I don't want to be like this. Of course I want to have intimacy again. That's what I miss more than anything. So it's important to know what your desires and needs are. So again, talking about the bioidentical hormone therapy, you can use local creams if you aren't wanting to go full bore into testosterone replacement. We can use troches, we can use the pellets as well. And men, typically they'll do the pellets or the injectables, and that's helpful. Herbal support can help with some of it. And I do have some women who do phenomenal with that, especially ones who are a little leery of hormone replacement for any reason. I never want a woman to do hormone replacement if they have any doubts, if you have any concerns, because one thing that I have learned is that when you have doubts and if you have high anxieties about a thing, guess what's going to come into your life? You're going to invite it into your life. And so I really truly believe in mindset and mindfulness and speaking things into being. So I only work with women on those hormone replacement who are ready. And I have some that they dip their toe in. I'm like, I'm going to do the troche and I want it this much. Okay, so we'll do that for a little bit. Okay, I think I'm ready for the cream. Okay, we'll do that. And finally, a year later, they're like, I'm so tired of doing that. And it does make me feel better. I have women who have diagnosed OCD, almost hospitalizable, like so severe that we get them on their testosterone replacement and we get the dose optimized, and like, I'm good. Like, I haven't been good in a long time. I'm really good. And I think it's a miracle. I think it's phenomenal. We're not having to use antidepressants or weird psych meds. It's so good. Skin and hair changes. So this is hormone related. It can be sex hormone. It can be thyroid hormone. It can be the mix of hormones being all over the place. Progesterone deficiency especially can lead to the skin getting dry, the hair thinning, and the skin texture. I don't know if anybody is noticing like more pits in their face, or they, you know, obviously we start wrinkling as we get older. Some of that accelerates when we have these hormone changes. When we support it, we can help. Bumps on the skin, like dry, rough patches on the body that you didn't have before, those can all be hormone related as well. Obviously, we want to do things like adequate hydration. Collagen's a great thing. Vitamin C is really good for healthy skin structure. But hormone balance can definitely help slow that clock and slow down those skin changes and hair loss. Sensory. These are some of my favorite ones when I help people with this. So the annoyance by loud sounds, bright lights. My shirt feels wrong. I can't have socks on. My shirt's choking me. My pants just like rub me wrong. Like I can't, if I don't want to be touched, you know, the texture of this food, I don't understand. It's all new. This wasn't the way I used to be. I must be going crazy. I actually get that. Another person that I've been taking care of and trying to help, heart palpitations. Been going through it for 10 years. I'm like, this is perimenopause. Like, come on. Heart palpitations. She's had cardiac workup. She's been on heart meds. She's da-da-da-da-da-da. Start hormone therapy. I missed a day and my heart palpitations came back. And I'm like, well, sorry it took you 10 years to find me. And I'm sorry the instructions on the bottle were wrong, because I don't know why the pharmacy did it wrong. They said to skip one day. And I'm like, let's not do that. We need you to be on this the whole time. And it helps. And so all of these weird random symptoms can be helped with proper hormone support and replacement when needed. Mindfulness is important, biofeedback, gentle movement, anti-inflammatory diet, and regular exercise. Those are all lifestyle things you can do, but hormone replacement can turn off that itchy trigger. You know, then we go into menopause. Those are the ones, again, some people just have a smooth sailing. Everything's great. But it's not that way for everybody. 6,000 females enter menopause daily. Average age of menopause in the US is 51. Symptoms can be in at any age. And I do have women in their 20s that come in complaining of problems. The ovaries, they slowly stop producing the estradiol, which creates symptoms. And then they start to slowly reduce their progesterone production, which leads to symptoms. And then their testosterone starts to decrease. But like we said, at age 40, it's already half. But if we start losing it at 20, the only way to keep it going between 20 and 40 is to do muscle building. We want to do muscle building, and we want to promote healthy conversion of the adrenals and the ovaries. And so it's really important for us to keep an eye on it and start early. We don't want to wait until it's too late. We can always pick up and try, but if we can tell and teach more people to start taking care of their bodies when they're young, that will help everybody so much more. So heart disease, that's a big one. 1 in 7 women die from heart disease before menopause. Not great odds, but not the worst. But when you look at the postmenopausal fatality rate in women from heart disease, it's 1 out of 3 that have a CVD event, a cardiovascular event. Sorry. 1 in 3 will die from that. And so there's a lot of, debate, but it's thought to be the lack of estrogen being protective over the heart muscle. When we replace testosterone, and then if you're postmenopausal and we replace the estradiol, we help support healthy function in the heart muscle, the bone, the brain, you name it. And so this is really a big reason for me why I want to get things supported before we have damage. Estrogen is so important. Men need it too. It's not as high in men as women, but if men don't have it, they also suffer from some symptoms. It can matter in their brain, and men will go through osteoporosis in certain situations if we suppress their hormones for like prostate cancer or some other things. In females, estradiol alone will help with the hot flashes. It improves and maintains the bone density and strength, decreases the breast cancer incidence and mortality. And again, this is one that I told you was under a lot of controversy, because some studies say one thing, but when we look at the cancer studies specifically, it's protective. It improves your cholesterol numbers. You want to know why? Your sex hormones are made out of cholesterol. Our body is designed beautifully to have a feedback system. So when the body is in deficit, it tells the body to save it and hold and absorb more because it needs to make it. Your brain is made out of cholesterol. Your nerves are made out of cholesterol. Your adrenal hormones are made out of cholesterol. Your sex hormones are made out of cholesterol. Need I say more? I don't suppress cholesterol in my patients unless it's absolutely necessary. I don't use statins in maybe more than 5 people in my practice of 500. I don't believe we need to suppress it without sign of vascular disease. And even that's under debate with the functional medicine world. So we need cholesterol, but we need healthy functioning cholesterol and healthy non-inflamed blood vessels. And so that's what I work on with people so that it's safe to let their cholesterol be a little higher. So hormone therapy, these are some of the options. So there's bioidentical molecules versus synthetic. What I want you to see is these little things. Remember when I said the key looked funny? This looks like human progesterone. While this is made from soy or yams, it's not human. It looks just like the human molecule. This is made from animal parts or animal urine. It's got a whole bunch of extra stuff on here, and that can create havoc in the body. We don't want that going on because we don't always know what that's going to do. It doesn't always pick up, or it might bind to something we don't want it to bind to. So the different routes of administration, there's oral or troches that dissolve between the cheek and gum, transdermal, which you apply in the lower genital areas, which is a cream, estrogen patches, injectable testosterone. There are some hormone practices in town that are doing injectable estrogen, progesterone, and testosterone, and I struggle with that. I'm not really a big fan of that administration route. And then there's the pellets. We use pellets predominantly here because of the ease of use. Women get the pellets placed every 3 to 4 months. You take a progesterone at night if you still have an intact uterus and you're getting estrogen, and men get pellets every 5 to 6 months. So guess what? You're not having to do every day. Apply a cream, let something dissolve between your cheek and gum, give yourself a shot twice a week or once a week or whatever. It's easy and very convenient. And I'm a happy user. There's other happy users in the room. So it works very well. Oral testosterone, in my opinion, is a no-go. There's way too many complications and risks associated with oral testosterone. I use troches, but if my patients tell me they're swallowing them, I scold them strongly because it needs to be absorbed here into the bloodstream, not through the digestive system and through the liver circulation. It's kind of inconvenient. It's only used in men. And again, I don't think it's ideal because of all the other side effects. Then there's the creams and gels. Absorption inconsistency, you have to put it on thin skin. Everybody's body is different. So some skin is thinner than others. Some people have skin rashes. Some people start growing hair where they apply testosterone, which is kind of a weird thing if you just apply it in one area and you've got a big hairy patch that you shave a lot more than others. You've got to put it on every day or you don't get the benefit. And so if people don't do it, or if they're like, it just takes half an hour to just sit and rub cream everywhere, it does mimic the endocrine system, which is great, you know, because it's absorbed and then the fat converts and then it moves into the system. Problem is it can transfer to others, and we don't need our kiddos, our loved ones, or our animals picking up our hormone replacements. If you have an estrogen cream, the last thing you need is your husband to be intimate with you, and then you transfer your estrogen, and now you don't know why he's getting man boobs and can't perform. And testosterone, just the little kids, they don't need any help with any estrogens. We have enough stuff in the environment today creating problems for the kiddos. Patches work really well. So I have some women that do testosterone pellets, but they don't want the estrogen in the pellets. So they'll apply a patch twice or once a week. And it works well if we have, especially somebody who's very sensitive to estrogen and we just don't always want to have it on. Because if the pellet's in, I can't take it out. So if they want to experiment with estrogen, with testosterone, this is a good way that I'll do it. It has less issues with transference because it's under the patch, and you're not supposed to be touching the underside of the patch with your fingers, so it shouldn't really get on your fingers. I'd still advise washing your hands though. The injectables, again, these have a lot more metabolites that can cause problems in the body. My men that are on testosterone injections tend to get more issues with thickened blood, with needing to stop hormone therapy for a while because their hematocrit goes up too much or their PSA rises or some other cholesterol changes. Some testosterones are clear. Some of them are in a white fatty substance. So it may artificially raise the cholesterol that way. The more injections you give yourself, the more risk you have. And these, if they have preservatives in them, you can get an allergic reaction to it. So it's seen more commonly with the injectables. And so the pellets, have I said enough about pellets? Do I need to talk more about pellets? I think they're really great. They're bioidentical. We have excellent outcomes with them. Our patients are usually satisfied. The ones that aren't, I've had one woman quit because I'm like, could see how that could be a problem. We could reduce the dose. She's like, no, I can't do this. So 1 out of hundreds. Okay. About 10% of women who have testosterone that is like negative or like -3 or just unmeasurable. If we overcorrect you too quickly, we can get weight gain, fluid retention, and just not feel great that first time. So I tend to lower the dose, especially on these lower testosterone women who are less than 20, because I don't want you to have this rapid turnover with the testosterone in your body. So we kind of like back that down. If it still happens, like I said, it's about 10% of our patients. We use a little diuretic to help your body clear it out and eliminate that fluid for a month or two. Yeah. Okay. So this is the fun thing. So one or the other in your butt cheeks. We numb it up. We make a little teeny tiny incision and use a device called a trocar, which is like if you pull out the inside of a big pen, you know, the little ink chamber, it's about that big around. Then we slide that into the little incision we've made and deposit the pellets there, pull it out, put a steri strip on it, put a dressing on it, and you leave that on for 3 days for women, 7 days for men. And they just live there and they dissolve over time. And the worst part is getting numbed up, honestly. I think the lidocaine, since it stings, the rest of it it's like that. Yeah. Every 3 to 4 months. Yeah. So while the procedure part seems a little like daunting to some folks, once you get the benefit, you're like, this is nothing. I'll just come here. Which cheek is it? This, you know, so it's really quick. And men have a lot more testosterone pellets placed than women do. So they have a little bit longer healing time, and they get like, for a woman, you might get 1 or 2 little pellets placed depending on how many milligrams you need. Men will get anywhere from 6 to 12. So that's a lot more pellets. So we make a few passes, but again, my dad's on them, my husband's on them. There's a lot of other people that are really thriving on them and they love them. And they're like, don't let me get off schedule because I like the way I feel when I'm feeling good. So I say it's a simple procedure, but I treat everyone with respect, and everybody, if they need calm down, if they need music, if they need a fan, we just make it work for everybody so that they can feel good. And what other questions? Anything else on this?
What's the activity? Is that just 3 days?
No glutes. Yeah, for women, it's 3 days, for men, it's 7 days. And so it's no glute workout. So we don't want you on the stair climber. We don't want you, doing squats. We eliminate some of the bedroom activity, just anything that's going to make those glutes fire a lot, because we don't want it working the pellet out that little healing path. So the history of pellets. So this is kind of a busy little slide, but they've been used since 1939. That used to be the way, after a woman had a hysterectomy, that we would do hormone replacement, was with testosterone. And they used pellets because they were convenient. I think they studied it in animals first. And so the US kind of fell out of favor when Premarin and Prempro came in, because the pharmaceutical companies are like, these are great drugs. You should only use these. You guys are crazy for doing this stuff. It's, barbaric. Why are you poking holes in people? Europe continued to use them and had great results. Didn't have the same research studies that or didn't have the same experiences maybe we had with the hormone replacement. And then one of the exciting things about this company, there was a woman doctor who was doing breast cancer research. And what she was doing was inserting testosterone pellets around the breast tumors to see if it would help shrink and reduce or speed along cancer recovery. So cancer recovery was better. The people who had the testosterone versus the people who didn't, they both went through the same type therapy, chemo or radiation, whatever they were in their various treatment branches, but one had testosterone pellets placed around the tumor and one didn't. Thing about it is, just because it was placed here, not here, the body still absorbed it systemically. And the women who had the testosterone pellets came through all of the treatment phenomenally. When their treatment was over, their breast cancer was gone, everything was fine. They came back to the surgeon and said, I had so much energy. Can I have just the testosterone back? I mean, I really think it helped me. My energy was better. My libido was great. I didn't lose my hair. I didn't, like, all of these things that could have happened during cancer treatment didn't happen. And so this surgeon's like, let me do a little more research. So I have a bunch of her studies, and it's really phenomenal. So what we find is like a 4-fold reduction in recurrence of breast cancer, more than that, reduction in mortality rate or recurrent cancers later, in the life of people who are treated with testosterone therapy. So it's super amazing how we can help people maintain and stay in recovery. All right, 9 more slides. All right, so with the pellets, it's individualized dosing, precision dosing. You don't have to do it daily or weekly unless you're taking progesterone. You take that every night at bedtime. And the procedure is only done 2 to 4 times a year, depending on if you're a man or a woman. It helps your heart. And heart isn't just your heart. When we talk about the cardiovascular system, it's your blood vessels, and there's blood vessels everywhere. So your brain, your heart, your kidneys, your gonads, your extremities. So blood flow improves. Hair growth. People are like, Dr. Tilley, I started growing hair on my toes again, and it's just gross. I'm like, congratulations, you have good blood flow. That means that all of the things that your body needs to circulate is finally getting to your toes. Are your feet still cold at night? Oh, no. I have great blood flow. Are your hands cold anymore? I haven't had to wear my gloves inside for a while. It's really remarkable how much this makes a difference. And so it's not just your heart, it's the whole system that can improve here. With women, testosterone and estradiol in an appropriate person is really important. For bone health, this is one of the things, if I have anybody that has severe osteoporosis and they can do it, I want them to do hormone replacement, because it's going to have faster improvement in your bone mineral density than the injectables or the bisphosphonates. It's proven. It's like these slides changed. So I can't remember. Kate, do you remember what that slide said? I don't even remember.
Which one?
The bone density scan with hormones. It was like 7. It was like there was a 7, a 5, and a 2. And with hormone replacement, it was more rapid. I wish I had written that one down. I'm so sorry, but the testosterone has better improvement in bone mineral density than the pharmaceuticals. do at this point. It's in the book. We can look at it later, but yeah, it's just, to me, that was one of the things that stood out to me most. So the other things that can help with improving bone mineral density and hormones balance is working on body composition, improving lean muscle mass, knowing how to work out appropriately through the different phases in life, because it's not the same for everybody. A 20-year-old workout is not the same as a 40 or 50-year-old workout. It just is not. Our bodies don't tolerate the same stressors. And if we overstress certain parts of our body, we then put ourselves into fight and flight, and then we mess up our adrenal axis. And so we really need to be cautious about how we work out. The other thing that we're often taught is just get your 10,000 steps in, right? Just walk. Okay. If you walk every day, that's normal activity for your body. That is not a workout. So your body is not going to respond to your 10,000 steps. Pelvic floor health in women who've had children and some who haven't. We get laxity. So instead of having a nice, firm, held lower area, you know, where we might pee a little if we sneeze or cough, or if we squat down, you're like, you know, or if you try to run or jump, you can leak urine, and it's really unfortunate. Or if you can't have a functional bowel movement because everything moves when you're trying to push stool out, that is too much laxity. That's a real thing. Nobody talks about it. We talk about it here. Okay. So we want to tighten and improve that pelvic floor so that that little trampoline doesn't have so much sway in it. And then by doing that, we can improve urinary incontinence and fecal issues, as well as sexual wellness, because increased blood flow to that area, good thing. And then biohacking. I'll talk a little bit about some of that. So with exercise, you can hit the gym, you can get your 10,000 steps a day. You can come in and use the M Sculpt, and you can get your muscle mass improved by 27% and reduce your fat in the area by 30% in 4 treatment sessions of 30 minutes each. It's like 4 months in the gym every day. And so we can improve that. The Emsella builds the pelvic floor muscles and can, so it's an electromagnetic pulse. So we can do test runs. So I know some people, you might want to look outside, see, check the weather and all that, but I want everybody to be able to test drive some of the stuff we have here. So this is electromagnetic pulses. So what that means is you sit on the chair, kind of like you're getting on a horse, because you want to have a wide stance on it. And we get the legs raised to the right height. This is a little low for me, but we get you to 90, 90, 90. And then when we turn it on, it creates an electromagnetic pulse, kind of in a cone about 10 centimeters deep into you. It's about belly button height or lower. And it contracts all of the muscles. So it's not just one muscle. We get you set up and it will contract your inner thighs, your lower belly. People with sciatica sometimes get improvement because it improves all of those little muscles around your tailbone and the coccyx that hurt so much. If you've ever fallen on your tailbone, that really hurts. So these muscles improve and it lifts that within one session. I have so many people say, I'm coming back because I didn't pee myself this week. And it was great. So they come back in and keep doing it. So the first round is 2 sessions a week for 3 weeks. And then we do maintenance every 1 to 3 months, depending on if your symptoms come back. But it's phenomenal. It's 11,000 Kegels in half an hour. So what it does, there's a little tap, 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 tap that happens, and that drains the lactic acid. So when you get up, it's not like you've just done the massive workout that you've just done, but you feel like you went for a nice long walk and you held your muscles just right the whole time. It's a really amazing feeling. So that's how that one works. That one uses radio frequency and that electromagnetic. So it heats and then contracts the muscles. It's not just for fat loss and muscle building, you know, aesthetically. It has functional pain management programs in it. So if you have shoulder pain, hip pain, knee pain, ankle, wrist, whatever, we can apply the paddles in those areas and improve that pain. It's pretty amazing equipment. Let's see here. So we talked about the Emsella. I just gave you the whole rundown right there. So you got ahead of me. Biohacking. Okay. So has anybody heard of Dave Asprey? Okay. So biohacking is a thing. It's how can we make ourselves healthier faster? How do we skip steps? How can we quantum leap into wellness without having to do as much hard work? One of his books is called Smarter, Not Harder. I absolutely love it. For cognitive health, physical health, cardiovascular wellness, all of that. So what we talk about there is things that you can do on a day-to-day basis that allows you to get kind of light years ahead of where you'd be if you just kept doing what you're doing. Things like eating the right combined foods, using the sauna to help your body detox faster, using IV therapy to help your body's immune system improve quickly, giving yourself glutathione to help your body with detox and all of that. Peptides. Peptides is kind of a new thing on the horizon. I am getting into the study of peptides. I've been using NAD plus and sermorelin, which is a growth hormone precursor, for about 2 months now. And my brain fog, the hormones helped a lot, but my photographic memory is coming back after 2 head injuries and encephalitis from West Nile virus. I never thought I'd get that back, but I'm like, I was telling Kate, I'm like, I can remember my 8-digit bank routing number now. I just look at it, or, you know, I can flip between screens and remember things that I wasn't remembering. That it was, so it's really exciting to me. So these are some of the ways I can work with people here. Again, I was trying to like speed through, so we had time to do everything. Key takeaways. This can happen at any age. It's never too early to be cognizant. If you don't feel right, get help. I work with girls that come to college here and they're like, they're heavy periods, acne, hair loss, oily hair, just don't feel right in their body, early pain, autoimmune disease that they've been diagnosed with. And we look into this stuff because it's not just one thing. It's the whole system. You're a whole person. You're a body, your mind, and you're a spirit. And so that's some of the other stuff I do here. I have the Quantum Metabolic Reset program, which is a program to do that deep dive. Yes, it's geared to losing weight, but we don't all have a lot of pounds to lose. But we might have a lot of spiritual, emotional, or physical, you know, or a mental weight that we want to get rid of because it's holding us back from becoming our optimal self. And that is one of the programs that I absolutely adore running. We meet every Monday night. So again, it's not a one-stop shop or one size fits all. We do optimize it to your unique unicorn personality. So I work with a lot of unicorns here. So that's what we do. What questions can I answer?
Does insurance cover any of the services?
So if you're a man, yeah, you can get your testosterone covered. If you're a woman, you don't need that. So no, for most women, testosterone replacement is not covered. Estrogen might be, but it's going to be the conjugated equine estrogen with the progestin. It's not going to be the bioidentical hormones. Like Blue Cross Federal covers more stuff than most, but most insurances won't cover it. If you have an FSA or an HSA plan, you can use that to get it covered. That's how a lot of women pay for it, by using their FSA or HSA money. When it comes to labs, if you're a member for us, we will help you get your labs done through insurance because there's a lot of hoops to jump through. So if you're a member, we do that. If you're a non-member, we use cash pricing on labs so we can get them at 1/10 of the cost of what it would be going through your insurance anyway. And so we use cash-based pricing through Access Lab. Yeah, it is. It really is. What other questions? Does that answer? Yeah.
Dr. Tilley, what's your opinion like post-menopause, no estrogen because of breast cancer? If you don't have any estrogen, is it really thing to take estrogen?
So that's where there's a lot of controversy. So if you've had a hormone receptor positive cancer of some sort, it makes it really difficult for some people to say, yeah, we can do that. My favorite thing to do in these situations is, as long as we kind of have the blessing of the oncologist, because a lot of them do want you to have recovery or some symptom relief, we'll do the testosterone with the nostrozole so that we're not giving estrogen, or that we're blocking the conversion in the body to estrogen in case that were to become a problem. Because even if you've had like mastectomy or you've had a hysterectomy or things like that, there are other hormone receptors in the body. What I would say is, when we do the protective route and monitor the estrogen levels, we have women who are doing great after that. So it's been really good. And it's just the testosterone. So it does a lot in the body. Yeah. What other questions can I answer? Awesome. All right, I'm gonna try to stop the Zoom and stop the,
I
oh,
have
just
I have
questions.
some
Yes.
questions. Yes.
Yes.
Just a couple. What is the association with surgical menopause and muscle loss? I had a surgical menopause in June of this year, was sent home without any hormones. I am on the struggle bus and I am curious, as far as muscle goes, I have I've shriveled up to a little old lady and I'm 42.
Right. So did they take your ovaries because you were in your 40s?
They took my ovaries. I had extensive endometriosis and I had blood-filled cysts. Everything was taken. I have nothing. And like I said, I'm on the struggle bus. I am not sleeping. I am sweating profusely at night, especially. And I have, I have lost so much muscle
Yeah.
tone and I'm also curious about how you work well with, other issues, specifically like Hashimoto's thyroid. And then not only autoimmune, but primary immune disorders.
Sure. So 3 different questions. So I'll answer the one about menopause first, the surgical menopause. So did they put you on any hormone replacement afterwards?
No, they sent me home and I have been in my sorrows ever since.
I'm going to apologize for you because that is almost malfeasance, malpractice to me at 40. What they did is they did put you into menopause and they probably said good luck if they said anything at all. Easing you into it, most doctors in the Kansas City area would have put a patch on you and told you to wear the patch for the next 6 to 9 months, and then they would have you stop it and see how you felt. In my experience, I have women coming to me 5, 6, 10 years after that kind of treatment, and I still start hormone therapy because I want to turn back whatever clock we can to get you optimized. The reason you're losing muscle mass, like I said, when you go through menopause, you age like 5 years in a week. It's so fast. And so what you are doing is you essentially don't have hormones. They're not in your body doing any function. So what I would do is we'd check your hormones, see where you're at, and then optimize a program for you, either through troches, creams, or pellets. When it comes to Hashimoto's, I do a lot of autoimmune work. Autoimmune work is probably as prevalent in my practice as the hormones at this point. Autoimmune disease is highly reactive to stress and well-being in the body. So my quantum metabolic reset program, we have people turning around their autoimmune disease. Like the markers are going away. They're going into remission essentially. And it's through diet, it's through lifestyle, it's through mindfulness, it's through like reframing your brain. It's an amazing thing. So I do that. I can teach you that outside of that program as well. And primary immune disorders, it really, it depends what it is and what help you're needing. Yeah. And you don't have to go into that here publicly, but yes, I work with a lot of folks that are in that position who maybe don't want to be forced to take a whole bunch of vaccines. They want to know what they can do to prevent infection naturally. And we have different ways that we can work with folks on that.
Very, very good. And then lastly, my question is, and I'm sure you're probably going to touch base on it, but is cost. I know you mentioned that most often insurance doesn't pay for a lot of the things, but what does, say, a base fee get you? Does that take care of you for 6 months or a year? I have a sister who does something similar, and she pays like a flat fee, and it gives her certain things for the year. Other things are out of pocket, and I'm just curious
Sure.
if that's something more on a personal base where I need to call in,
Sure.
or if you can disclose.
No, I can share that here. So the ways that I work with people here, we have a basic primary care membership. It's $129 a month for an individual, $229 for a couple, and then $300 for 2 adults and up to 4 children under 18. And then for all the kids past 4 kids, it's $25 per kid per month. All of those are per month. And that gets you access to us for visits. It gets 20% discount on supplements. We'll run labs through insurance if you have insurance, or you can still take advantage of our cash pricing. We do dispense pharmaceutical meds here when needed at low cash prices. If you can get a better deal through a pharmacy with GoodRx, we'll do that as well. We have a lot of other perks, discounts on IV therapy, 3 free sauna sessions a year. We have an infrared sauna here that is just a miraculous thing. It's lovely. So that's the primary care membership. I have a functional medicine track, which is $3,000 for 6 months. That is a monthly visit with me. The first visit's 2 hours, and then each visit after that is 1 hour. And what we do is we have a foundational lab panel called the Health Span panel that's included in that price. That gives us a very broad stroke of your snapshot of what's going on in your body right now with metabolism, hormones, thyroid, adrenals, inflammation, and all of that. And then there's extra functional testing based on your needs that we do that are at an added cost. And then the quantum metabolic program, it's variable in price. There's the deep dive program where you get some functional labs done and an online group program, and it's $3,500 for the 3-month deep dive with those extra labs. And then there's a lower cost session in that, which is $1,500. That is still the 12-week program, but it doesn't cover all the labs. Hormone replacement, that might be the next question you have. We do per session. So for women, the initial consultation is $330, and that includes a visit with me plus the labs. If you're a member, you don't pay the $150 of that, which is the session fee. And we can still run your labs through your insurance or through that low cost instead of the cash price of the $180 for the labs. Tonight, we're offering $150 off that initial consult with the labs. So you're just paying for the labs essentially, if that's something you'd like to do. For the hormone pelleting, for women, it's $380 per session, and for men, it's $730 per session. So women do that 3 to 4 times a year. Men will do it 2 to 3 times a year, depending on how frequently they're doing their pelleting. So does that answer your questions?
That's a pretty good approach. I do question, for instance, like you said, the pelleting is $380 per session, and that is in addition to if you were to do something, say, you said like the deep dive was like $3,500 for 3 months.
Yes. Yeah. With our hormone replacement program, we have a very, very low profit margin on that. And we come in cheaper than just about anybody else in town. And I don't like the word cheap, cheapens it. But what I have done is not raise the prices because I want to be available to serve this to as many people as possible. So we're coming in 150 or more less than many of the other practices in town.
Okay. And then one more question. What does a typical treatment look like? For instance, if you were to, you said the pellets you do every 3 to 4 months. So does that mean you're typically seeing someone every 3 to 4 months, or are they in more often depending on their needs? How does that work?
The hormone replacement therapy is only for hormones. We will touch on thyroid, we will touch on hormone replacement, but if you have any needs outside of that, you need to be a member or you need to be in the other program, because it's focused only on the hormones during those sessions. We will talk about, nutritionals. We'll talk about supplements like the right vitamin B, ADK, those kind of things. But it's not time to go into like, how do I cure my Hashimoto's? How do we go into all of the other more complex issues? It's just hormones. So our members pay that same price. Anybody will pay this price. It's not discounted for members just because there's very low profit margin on it right now.
Very good. I appreciate all the info, and I appreciate you doing this by Zoom as I live a distance, and thank you for your time. Thank you.
Of course, no problem. I'm so glad you were here. I see a couple other folks on there. Anybody else have questions? All right. Usually I can see who's here. There it is. All right, there's a couple. All right. Well, what I'm going to do is go ahead and stop the recording now, and then we're going to have playtime. So you guys at home, you're going to miss out. What I do want to say is we are doing an MCELA discount here. I don't know if you can see that. MCELA and MSculpt discount for tonight. So if that's appealing to anybody, feel free to reach out and call and talk to Kate or Jean or Melanie, and we can get that set up for you. So that's these devices here. We're offering member pricing to anybody who signs up tonight. So you can get priced just like you remember, whether you are or not. And then for our hormone replacement therapy, is that on the table, this one, Kate? So we have an annual plan that does give some discount if you buy it all in a year. So you can get the whole year's worth of services. That'll include the lab, all of your pellets, and your follow-up lab. at a discount today. We're taking off that visit fee, and did we add something else in there? I can't recall.
No.
Okay, so, but yeah, so it's including all of your follow-up labs, which is, with this, we do trough labs. So the first set of pellets, we do pelleting, and then we want to do labs 2 weeks before your next set. So we know if it's too early or not. So we don't want to stack hormones. We want to give them to you when you need them. So this is also how we can kind of space out the right way, how much you need on your hormone replacement. Well, very good. All right, so I'm going to go ahead and close here.